Sad story, Dr. Nandy.
100%. You know,
Yeah.
we were absolutely shocked and devastated in my
Yes.
household. And Chadwick Boseman was a hero for us on the big screen and in real life. And my kids, Kelly and I, were just had a tremendous loss. Even though we didn't know him, we absolutely loved King T'Challa and Black Panther. We watched it again this weekend. Now, Chadwick's death at age 43 is another example of how colon cancer is increasing in young Americans. A month ago, right, we talked about the passing of a great Detroit sports radio host, Jamie Samuelson, from the same disease. The Journal of the National Cancer Institute is saying that colon cancer rates have risen each year since the 1980s in people that are ages 20 to 39 years of age. There's also a slight uptick in cases in 40 to 54-year-olds since the mid-1990s. And the American Cancer Society, as a result, now recommends screening colonoscopies at age 45. And people need to hear that and know that if you have an immediate family member diagnosed with colon cancer, you should get screened 10 years earlier than the relative's age when they had it. So if your mom had colon cancer at age 45, you should get screened at age 35. And this is a topic that's close to my heart. I'm a gastroenterologist. I perform colonoscopies, and I see patients still die with colon cancer. And we must know that it takes several years for a polyp, which is a small growth, to develop into cancer. So I can't stress enough the importance of getting screened on a regular basis.
So, Dr. Nandy, do we know what's behind the increase in colon cancer rates, especially among younger people?
And this is a million-dollar question. Unfortunately, Alan, there are still a lot of questions as to why we're seeing the rise and why it's happening so fast. Is it the obesity epidemic? Is it the diet? We don't really quite know yet. But we do know that younger, healthier people, and those who are watching right now, may not get regular checkups, right? Because they tend to ignore symptoms and they think that colon cancer, well, that's a disease for old folks and I'm not going to get tested. And that's a wrong approach. So cancer is often at an advanced stage when it's diagnosed. And by the way, with the screening, we're seeing a decline in colorectal cancer in the older population because they're believing the screening and partaking in it.
And Dr. Nandy, as you said, King T'Challa, a hero in my home as well. And it was just so sad to see what happened and to know that he was working the entire time through that, even through his treatments and all of that. So, and he appeared fairly healthy. So what are the risk factors for colon cancer?
Absolutely. Everybody was shocked because they didn't even know he had it, right? But here are the risk factors. Family history is big, right? Lifestyle is something we can prevent. So huge factors in your chance of developing colon cancer. Now, obesity, a poor diet, lack of exercise puts you at higher risk. We can prevent all that. But it's never too late. If you think, well, I've been eating crap all my life, it's too late. It's never too late to start taking care of your health, right? Ditch the fast food, ditch the processed foods that can cause inflammation in the gut, and get more fiber from vegetables and fruits. We talk about this, but it's really true. Stay active, maintain a healthy weight, and again, get screened, right? Early detection of colon cancer makes a huge difference in the outcome. We can prevent this and eradicate this deadly killer, right? That's the whole story.
And the only story.
That's exactly right, right? Wakanda.
Yes, forever. Thank you,
right.
Dr. Nandy.
You're welcome.